Working as a physio for the last 25 years, I have my own ideas about what causes sciatica. But let's ask AI what the most common cause of sciatica is. AI, what is the most common cause of sciatica? The most common cause of sciatica is a slipped or herniated disc in the spine. Other factors are spinal stenosis, bone spurs, spondylolisthesis, piriformis syndrome, injuries or trauma to the lower back, and other less common causes. So according to AI, so obviously it must be true, the most common cause of sciatica is a herniated disc, and to a certain extent, I agree. However, there are some exceptions, a clear exception, and I'll explain about that in a minute. But first, let's explain exactly what a herniated disc is. Now, an intravertebral disc is a flat, round structure located between the two vertebrae in the spine, and it has this tough outer layer and this sort of squashy gel-like center, and it's present all the way through the spine at every level. Its function is to cushion and protect the bones of the spine, and when you move it, it allows that good quality movement and allows you to twist and to bend. Now, a hernia is a condition which has basically a protrusion from a structure, and that is, in a disc aspect, is when an injury occurs to the disc, that gel-like portion that's a little bit like toothpaste is pushed outwards and protrudes and is a hernia. And it's often to the back of the disc and often slightly to one side. And that's exactly where the nerve is and exits the spine. And it can press on that nerve, causing pain down the leg, down the line of the nerve. Now, there is one great exercise that helps people with a herniated disc. But before I demonstrate that, I want you to take note of something. And that is, it very much depends on how old you are. Now, a disc that is herniated is only the most common cause of sciatica in people who are under the age of 55. You see, as we age, our discs progressively lose their water content, and this means that the gel-like inner portion becomes more bone-like, meaning that basically no longer has so much risk of herniating in an acute way. Instead, people who are over the age of 55 have other causes of sciatica. So if you're over 55 watching this, I recommend not doing the following exercise, and instead you should look at a different video, which I did for this age category, over 55s. However, for under 55s, the first exercise I try to see whether it improves their leg symptoms is called a McKenzie extension. And the idea of this exercise is that you extend backwards and it can squeeze that disc-like material away from the nerve and relieve some of those nerve symptoms. So before we start on the lumbar extensions, I always recommend that you should get checked out by a health professional and never do anything that significantly increases your pain, especially your leg pain. These exercises are obviously not for everyone, and there should be a clear benefit to doing exercises in terms of reductions in pain. That said, now if you are able to, it's a case of lying on the floor. Now, it's very important that you can get back up from the floor, so don't try to do this if you struggle with that. But if you're able to comfortably enough lie on your front on the floor, that's where we start. The McKenzie extension basically involves pushing upwards with our hands only as far as we can comfortably go, and what we need to do is make sure our pelvis stays in contact with the ground. Now, we will go up to a level where it's comfortable and return back down, and we'll do this slowly and steadily for 10 repetitions. If it's increasing your leg symptoms, then please do not continue this exercise, and that goes for afterwards as well, because the best way to assess whether this is a good exercise for you is to see whether your leg symptoms are any different afterwards. And if your leg symptoms are worse, then it's not a good exercise for you. But if your leg symptoms are about the same or better, even a little bit, then potentially this is a good exercise. So I always recommend that people try to do some 10 repetitions over, say, every hour over the day, and see if the cumulative effect results in a slight reduction or a significant reduction in leg symptoms. Now, if you're finding that this is a good exercise, what you can often do is start to extend the range from a limited range through to a more extended range, but only if the back and the leg symptoms allow. You should only go up to a comfortable level and return back down. And generally speaking, if you can go up further, it is a good sign and you are getting better. So I hope that was useful to you, and if you're under the age of 55, suffering from sciatica, it's possible that it could well have helped you. I also have a free ebook available. If you'd like to get the free download, then check the description.